We are here to launch a European network to understand the HIV and STI epidemic within Europe.
STIPnet is an important study for a number of reasons. First and foremost is the fact that sexually transmitted infections, including HIV and other diseases, really represent a global public health threat. And HIV and other sexually transmitted infections often coexist, and that coexistence facilitates the perpetuation of both epidemics.
We are taking part in the STIPnet study because the number of new infections regarding sexually transmitted infections is on the rise, even in Hungary. And this study is a very good opportunity for the participants to be screened regularly for these sexually transmitted infections and to get new insights from these infections.
Expecting for the future that STIPnet will improve knowledge on incidence, prevalence of sexually transmitted disease in Europe in patients with high risk of HIV infection, I think is a crucial information.
So what we would like to do with the European HIV and STI Prevention Network is to first of all get an idea about the epidemic within Europe, to understand how many people are getting infected, at what rate, at what incidence, and how often they are becoming reinfected even if they are successfully treated with antibiotics. Ultimately, the goal of the network is to create and develop novel prevention methods to combat most of the sexually transmitted infections. So not only to have prevention methods against HIV, but also ultimately develop vaccines against gonorrhea, chlamydia, or other sexually transmitted infections. We are starting this network including Spain, Italy, France, Hungary, Poland, and Germany. And our plan is to first get an idea about those different epidemics within Europe. So to understand how often people are getting infected with sexually transmitted infections, including HIV or gonorrhea or other sexually transmitted infections. But once we have this data, then also expand into other groups, in other populations, to understand what is the epidemic in youth, what is the epidemic in female sex workers, and so on. We would like to go into different countries, except the 7 we have already. We would like to understand also the epidemics in other European countries, and ultimately have the goal to iteratively and rapidly test different prevention methods that might be useful in the different populations.